Hi, I'm Scott at Pediatric Orthotics. So, identifying signs of Severs on the field. The symptoms are easy to list, whether it's heel pain, swelling of the heel, abnormal gait. But there are some things you can look for before it gets to that point. A lot of the people I talk to here fall into kind of two categories. One is someone with a child who's had Severs for multiple years without finding a relief. But the other category is people who've recently had an almost traumatic experience with Severs where they've had to carry their child off the field or help them limp off the field and wondering what to do. So we wanted to kind of spread awareness of Severs and maybe give you some tools that you may be able to look for before it gets to that point. Now, I'm not a physician, but I've spoken to a lot of parents of children with Severs and doctors about Severs. Some of the things you can look for are maybe they need heating or icing after physical activities. They may take every opportunity to sit down when they can. And when standing, they may try to take pressure off their heels by maybe hovering their heels or standing on the balls of their feet or rolling their feet to the side, resting on the corners or outsides of their shoes.
I know you mentioned abnormal gait as a sign of Severs, but what does that really look like?
So they might walk or run on the balls of their feet like a toe walker, and because of that they might complain more about calf cramps or shin splints. They may also walk or run more on the sides of their feet a little bit. I had one parent who described it as looking like a cat with tape on the bottom of their feet.
Will they be doing these things all the time?
No, they may do these things inconsistently as their pain will be inconsistent in frequency and severity. A lot of these things you may think is just normal or a quirk of your child, but they can be signs of Severs. I'm Scott with Pediatric Orthotics. Thanks for watching.